Coronavirus cases are rising across the country. Now, U.S. health officials are recommending a booster shot for all eligible adults.
The plan calls for an extra dose 8 months after your second shot. The boosters could be available as early as September 20th. Sarah Hammond is breaking down the process for us.
After you got your second dose of the COVID-19 vaccine, you probably thought you were good to go. But now, U.S. health officials say you'll need to roll up your sleeve once again.
We are concerned that the current strong protection against severe infection, hospitalization, and death could decrease in the months ahead.
Pending FDA approval, the CDC is recommending a third shot 8 months after your second dose. So what does all of this mean for you? Well, right now that 8-month timeline is just for adults who got either the Pfizer or the Moderna shot. And for people who got the Johnson & Johnson vaccine, health officials do say you will probably need an extra shot, but they're still waiting for more data. As for children under 18 who are eligible for the vaccine, health officials are waiting to see what the FDA recommends for a third dose. And because of the timeline for the initial shots, healthcare workers, nursing home residents, and people with underlying conditions will be some of the first people to get the booster. All you need to do to get it is show your vaccine card. As for why we need the booster in the first place, U.S. Surgeon General Vivek Murthy says there are two main reasons.
Recent data makes clear that protection against mild and moderate disease has decreased over time. This is likely due to both waning immunity and the strength of the widespread Delta variant.
Health officials like Dr. Anthony Fauci say the main goal of the additional shot is to stay ahead of the virus instead of chasing it.
You get a dramatic increase in antibody titers when you do a third booster mRNA immunization.
Again, the third shot will be given starting September 20th, pending FDA and CDC approval. In Norfolk, Sarah Hammond, 13 News Now.
If you got your first and second dose of the vaccine, you may have experienced some flu-like symptoms the following day.
Yeah, it's unclear if, at this point, if the extra shot will affect people the same way.